You've been told you have cataracts, and you're probably flooded with a bunch of questions. Should I fix it right now? Can I wait safely? What happens if I delay? Well, today you're going to learn what cataracts are, the symptoms to watch for, and how doctors help you decide whether surgery makes sense now or later. Most cataracts develop slowly with age and can be often treated successfully once they start interfering with your daily life. So if you're wondering whether you can wait or if it's time to act, let's walk through it, starting with those first changes in your vision and what they really feel like. When the world starts to blur, the change can feel very subtle at first. A cataract is the clouding of the eye's natural lens that scatters light and blurs the image reaching the retina, the back part of the eye. This lens normally focuses light so you can see sharp details, but when it turns cloudy, that clarity slowly fades. The lens starts changing in middle age, yet many people don't notice real symptoms until their 60s. So small visual changes are common and worth keeping an eye on. At the beginning, the symptoms are often so gradual that you might chalk them up to normal aging. Your vision may look a little foggy, almost as though there's a light film has formed over your sight. Colors lose their punch, reds and blues appear muted, and you might find yourself squinting more often in bright lights. So sunlight or headlights at night can often cause halos or glare, turning everyday moments into uncomfortable challenges. It's not painful though, and it doesn't happen all at once. More like the slow dimming of the lights that creeps into your daily activities. And so one of the most telling examples is nighttime driving. A person who once cruised comfortably down the freeway in the evening might suddenly find that the oncoming headlights are unbearably glaring. And this individual might even switch to side streets or even giving up driving in the dark totally. And so while cutting back may feel like a minor adjustment, what's really happening is the vision changes are quietly reshaping decisions and limiting independence. And you also need to think about other daily habits too. Reading that favorite book may feel like trying to look through a dusty window. You can still make out the shapes and letters, but the crisp edges are missing. Additionally, following a recipe or watching a movie or even recognizing a friend across the room can take more effort. Over time, that fuzziness doesn't just dull the view, it can dull how much freedom you feel in your own daily routines. It's important to watch for sudden changes though. If you experience double vision in one eye, flashes of light, sudden pain, or a rapid drop in sight, don't wait. These are signs that you need to see an eye doctor right away. And so while cataracts usually progress slowly and predictably, sudden vision changes can point to other serious eye conditions that may need immediate care. And while these early cataract changes are often start off as a mild annoyance, the real question becomes whether they're beginning to interfere with your daily life. And that's where the focus shifts. Not just whether cataracts are present, but how much they're getting in the way of the things you need to do and love to do. So when it gets down to it, eye doctors recommend surgery based on how much the cataracts affect your daily life and safety, not just what it looks like on a clinical exam. Cataracts can be present for many years, but the real decision point isn't whether they exist. It's whether they've started to limit what you can do. So at your visit, your eye doctor will test the clarity of your vision, check the front and back of your eye, dilate your eye, and use a slit lamp microscope to look at your cataract lens. Just as important, they'll ask questions about your routines. Things like whether you can still drive comfortably, read recipes, or follow your favorite hobbies. These details can help tell your doctor more about whether surgery is needed in your case than just looking at the cloudiness of the lens under the microscope. The practical problems that often tip the balance can be very straightforward. Trouble driving at night due to glare and halos, difficulty reading or doing close-up work, struggling to recognize faces across a room, or even losing confidence in everyday tasks like cooking or navigating stairs. Each of these is a sign that vision is moving beyond slightly blurry into holding you back. And that doesn't mean surgery is always immediate. Many people live with mild cataracts for years without trouble. If you can still manage your daily activities safely and comfortably, there's usually no harm in waiting. But when vision begins to interfere with your activities, when reading requires extra lighting or night driving feels unsafe, that's when surgery offers some clear benefits. And consider some other everyday examples. A cook who once breezed through recipes and ingredients may find reading a spice label nearly impossible. Or a hobbyist who loved fine needlework may suddenly set it aside because threading a needle takes 20 frustrating minutes. And one I hear a lot, a golfer who could track every shot easily may watch their ball vanish into the sky mid-flight. Even something as basic as catching a neighbor's wave on the sidewalk can slip away. And none of these changes seem huge on their own, but together they can chip away at your confidence and your independence in your life. And if surgery isn't on the table now, it isn't a one-way street. Your doctor will explain the risks, the expected benefits, and the lens options available. Together, you'll weigh what fits your lifestyle and comfort level. That shared decision-making process is what makes cataract surgery elective. It happens when you and your doctor agree that it's time for surgery. But while waiting is often safe in the early stages, there is one key concern. Cataracts do keep progressing, and sometimes waiting too long brings on its own complications. So waiting too long can make surgery harder and increase the chance of complications. Cataracts don't just stay fixed in one state. They continue changing inside the eye, and with time, those changes affect how safe and straightforward cataract surgery can be. In the beginning, the lens is still very soft, which makes removal routine for surgeons. But over the years, that lens can harden and sometimes even swell. Once a cataract becomes dense or mature, it's technically more difficult to remove. That often means longer surgical time, more energy to take out the cataract, and more strain on delicate eye tissue, and potentially a slower recovery afterwards. Surgeons are well trained to handle these challenges, but operating on advanced cataracts comes with higher stakes compared to addressing it earlier. In advanced cases, there's a higher chance of problems such as increased eye pressure or other forms of cataract-related glaucoma. These changes inside the eye don't just complicate the procedure itself, they can also threaten other parts of the eye health. But I should note that while these situations aren't common, they remind us that postponing surgery indefinitely isn't always risk-free. This doesn't mean you should panic or feel rushed. Cataract surgery remains one of the safest and most successful operations in modern medicine. Millions of people each year regain clear sight through it, and most recover smoothly. The point to keep in mind is that outcomes tend to become more predictable when cataracts are treated before they become extremely advanced. Earlier surgery generally means a simpler procedure, less surgical energy needed, and a clearer path to sharp vision again. So where does this leave us? Cataracts are simply a clouding of the eye's natural lens, and the key decision about surgery comes down to how much they affect your daily life and safety. When vision starts to interfere with tasks like reading, driving, or recognizing faces, that's usually the tipping point. Modern cataract surgery is commonly done as a day surgery under local anesthesia and is considered safe and effective for restoring vision in many people. Many people also feel a big improvement in everyday life afterward, from clearer vision to greater confidence in daily activities. So, if you've noticed changes, schedule an eye exam and tell your doctor how your vision affects your daily tasks. And if you found this video helpful, let us know in the comments. I'd love to hear your thoughts. Please like and subscribe. I'll see you in the next video.